Britain has an obesity crisis. More than a quarter of adults are now obese.
This tidal wave of ill health that's coming towards us, we're only in the foothills of it, and people just don't realise it.
A new generation of weight loss drugs is being hailed as a potential solution.
It is a very, very, very small needle. You inject and it's done.
One of them, Wegovy, is now being rolled out on the NHS.
Wegovy is a game changer for the NHS, way more effective than any other medication or lifestyle intervention we've ever had to this point.
Millions of us would like to lose weight. So are the new drugs the answer to the obesity crisis? And are there any drawbacks?
I've just got a banging headache like I've got an ocular migraine.
And is the NHS ready for the next stage in the battle against obesity?
These drugs are available, but we are not able to use it in the NHS effectively. So it's a real problem.
Casey is about to become one of the first NHS patients in the UK to be prescribed the weight loss drug Wegovy.
Come in. Morning. Hello, hi, morning. Hi, Casey, come and have a seat.
She's come to one of a handful of weight loss services who have started to roll out the drug.
Not too bad, things are going well.
So it's been a few months since I last saw you. How have things been going?
Yeah, things have been okay, going well.
Casey needs to lose weight in order to qualify for fertility treatment on the NHS.
All right, so the purpose of the consultation today was to get you started on some Wegovy.
Yep.
So I know we've talked about that before, but we're now in a position to be able to prescribe it for you.
Fabulous.
So just to explain a little bit about how it works, it's an injection that you give yourself once a week. So how it works by slowing down how fast everything moves through your system. So essentially, you feel fuller for longer. All right. And it also sends a message directly from your stomach to your brain, telling you that you're fuller than you are, so it kind of tricks you into eating a bit less.
Yeah.
The NHS is only prescribing Wegovy to patients who are living with obesity and have an associated health condition. It must be prescribed through specialist NHS weight management services, currently for a maximum of 2 years.
So, yeah, if you can take that to the hospital pharmacy, not the community pharmacy, OK?
These clinics provide patients with advice and support on food and exercise from dietitians and physiotherapists.
So it's really important that when you're taking this medication that you still carry on with the diet and exercise that you're doing.
Psychologists also support patients with any complex issues that may contribute to their obesity.
So I gather that you may have a diagnosis of ARFID, which is avoidant restrictive food intake disorder.
It's a recognised eating disorder.
But I gather the psychologist is helping you with that.
Because of the support I've had from the dietitian and psychologist, we've been able to find a way through. So hopefully with some therapy, we can make some progress.
So we know that the rates of obesity in the UK have tripled in the last 30 years. The impact on the NHS is really quite significant. Things like diabetes, hypertension, mental health issues, joint pains, some forms of cancer are more likely.
Hospital admissions linked to obesity have doubled in the last 6 years to 3,000 a day. The government says obesity costs the NHS more than £6 billion a year. After smoking, it's the second biggest cause of cancer.
Wegovy is a game changer for the NHS. On average, you can expect to lose 15% of your starting weight with Wegovy, and that's way more effective than any other medication or lifestyle intervention we've ever had to this point. It can just be because it kickstarts a positive cycle, so they lose 15% of their body weight, and so their aches and pains reduce, so they're more able to exercise. For lots of people, they talk about waking up first thing in the morning, and all they can think about is what they can eat next. And they tell me that Wegovy reduces all of that.
To find out more about how Wegovy works, I'm meeting Professor Trisha Tan. She's been involved in developing this new treatment. It works by mimicking a naturally occurring hormone in the body called GLP-1.
So GLP-1 is a hormone that's secreted from your gut. And let me use this aid here to take you through. So I'm going to go through the layers. So first we'll go through the skin, the muscle layer, and right down into the gut. GLP-1 is a hormone that's released from our small intestine after we eat. And there are two main functions of the GLP-1. The first thing is that it signals to the pancreas, which sits behind the stomach, to release insulin. So insulin is another hormone that's very important because it brings blood sugars down and allows us to process and store the food that we've eaten. The second important role of these hormones is that it will signal to the brain to tell us that we've eaten, we're full, and stop eating.
More than 4 million people could be eligible for Wegovy on the NHS. However, until now, the only patients taking the drugs in the UK have been those buying them privately.
Hey guys, how are you? I'm doing really well this week. This is my midweek update.
I've come to meet Kelly, who's been posting about her weight loss journey on TikTok. She's been buying Wegovy online for the last 6 weeks.
Kelly, hi, I'm Michelle.
Hi, nice to meet you, Michelle.
Nice
Come on
to
in.
meet you. Thank you so much.
You're most welcome. So post-COVID, I was piling on the weight. I thought, do you know what, I've got to do something about this, because I was nearly 23 stone at that point.
Like millions of others nationwide, Kelly is desperate to lose more weight.
You do feel that people are judging you and looking at you because you're carrying this extra weight. So it does really affect your self-esteem as well. I shouldn't have let myself get to that stage in the first place.
It's hard though, isn't it?
It is hard, yeah. Very hard. And my husband and my children are all a healthy weight. And yeah, you do.
Oh, I'm sorry.
No, it's all right. It's even like going out and eating. If I went out to a restaurant with my husband and kids and I could be eating a chicken salad, you always feel like people looking at you thinking, oh, look at that. Look at her over there eating.
Kelly was taking another weight loss drug and lost 4 stone, but then couldn't lose any more excess weight. 6 weeks ago, she switched to Wegovy. It's costing her around £200 a month.
How often do you take it? How does it make you feel day to day?
So Wegovy is a once weekly injection. It is a very, very, very small needle, so it just goes into the subcutaneous fat on your skin. It's 4 millimeters long, so it just goes in, you inject, and it's done. You do get fuller quicker, so I do feel less hungry.
Wegovy is one of a new generation of drugs which are being hailed as game changers in the fight against obesity. Building on science developed to help treat type 2 diabetes, they found some extraordinary initial results when it comes to weight loss and stand to make big profits for the companies involved. Last year, Novo Nordisk, the makers of Wegovy, became the most valuable company in Europe. However, for some patients on weight loss drugs, there are side effects.
I've just got a banging headache, like I've got an ocular migraine, and I also feel nauseous, like early pregnancy nausea.
The majority of Wegovy users experience nausea, headaches, or tiredness. And while they're much less common, there can be other side effects which are more serious. They include pancreatitis, hypoglycemia, kidney problems, and depression, to name just a few. The long-term effects of all the new generation of weight loss drugs are still unclear, and it'll be years before we fully understand them. Because she's buying Wegovy online, Kelly isn't being supervised by a doctor. So we've arranged for her to discuss the impact Wegovy might be having on her with a medical scientist and nutritionist at Imperial College London.
Hi, Kelly.
Dr. Federica Amati.
Come this way, we're going to this room here. Can you tell me about the side effects for Wegovy specifically?
I'll get like waves of nausea, just randomly come from anywhere, and it can be usually triggered by smells, even nice smells.
And Kelly isn't alone.
And yesterday morning, I don't think I have been so sick.
And honestly, I'm just not hungry whatsoever, and I know that's really bad.
I just physically cannot eat the amount that I am expected to.
Noodles, and I can't eat it because I'm just not hungry.
I want to get back in a place where I'm exercising again, but sometimes I can feel tired, too tired to do anything, and I'm just not prioritising it.
But what you're saying is actually the side effects of the drug itself makes keeping that exercise up quite difficult.
For me, yes, the tiredness has been quite extreme.
First of all, we're going to get your height and your weight measured really carefully. So if you just jump onto these scales for me.
The measurement is completed.
Next for Kelly is a special machine called a DEXA scanner.
What this DEXA scan will show us is really your body composition and how your fat mass and your lean muscle mass is distributed throughout your body.
Dr. Amati wants to find out if Kelly's weight poses a risk to her health.
Brilliant. So, Kelly, we have your results. So the blue colours are the bone, the lean mass is the pink, bright pink colour, and then the yellows and the sort of light oranges are your fat mass. Your visceral fat, which is the fat that accumulates around your organs, is of special interest because higher visceral fat amount is correlated with a higher risk of, for example, heart disease. The good news is that your visceral fat mass, whilst is higher, so you're at slightly increased risk, but you're not actually in the high risk category.
That's really interesting.
Yeah, so that's good news.
However, Dr. Amati says using the drug without supervision could pose potential risks for Kelly and cause her to lose the wrong kind of weight.
So whilst you're taking Wegovy, you will see an overall reduction in your overall mass, and that includes fat mass. The danger is that as you rapidly lose weight, you also lose quite a lot of lean muscle mass. And losing lean muscle mass is really not good for long-term health. So having reduced lean muscle mass puts you at higher risk of metabolic disease. And in the long term, it can put you at higher risk of things like frailty.
I didn't realise how important the lean muscle mass was.
Although Kelly is losing weight, she'll need careful monitoring to ensure she doesn't put her long-term health at risk.
I actually think it's dangerous to take these drugs without knowing that it's really crucial to maintain muscle mass through appropriate nutrition and resistance training throughout treatment.
Through Kelly's social media posts, she's in touch with others also buying Wegovy online. She's become worried about the way some of them are using it.
I have been contacted by a very small minority of people, and they're looking to abuse the medication to stay slim. And I'm worried about what effect that could have on their short-term and their long-term health.
Wegovy should only be prescribed to people whose weight is impacting their health. But Kelly says people are buying the drugs from online pharmacies for cosmetic reasons and lying about their weight.
Would I be able to go through and potentially get the medication, do you think?
Potentially, yes. You would have to put in false details.
Well, let's have a look, shall we, at the website, because I'd be interested to see just how easy it is to order.
Like the people contacting Kelly, I put in false details about my weight. Many sites ask for picture ID, but some don't and seem to have little in the way of checks.
Is there any follow-up? Do they call you and review what you've put online?
No, I've never had a call.
So we've got the delivery address, we've got the medication, proceed to payment. I mean, this is quite a heavy-duty drug to be taking, and I could have this tomorrow.
Yeah.
Wow.
Does it concern you that people can essentially go online and order the drugs next day delivery, depending on what information they put,
Yeah,
you know, on the website?
it's of concern because these drugs are not meant to be used from a cosmetic perspective. You can lose excessive amounts of weight, and not only just losing fat, but you end up also losing muscle mass. It's what we call lean mass, and there's serious consequences.
Professor Tan says that alongside diet and exercise advice, psychological support is also important.
We see a lot of patients who are fairly complex, requiring both not just dietetic input, but also psychological input. You need to actually support these patients with, you know, lifestyle dietetic changes, address any psychological problems. If we actually haven't addressed the underlying problem that has led to the obesity, then the treatments, you know, outcomes will not be as effective, because we know that when you come off the drugs, you regain the weight.
As a result, the NHS guidance for Wegovy is clear. To ensure their effectiveness and their safety, they're only being prescribed to NHS patients through specialist weight management services, which provide nutritional, physical and psychological support. Despite the millions who could benefit from Wegovy, at the moment your chance of being prescribed this treatment on the NHS depends on where you live. Dr. Karen Coleman has been studying how the NHS will meet the demand through what are called Tier 3 weight management clinics.
Tier 3 weight management services are critically important to allow for people to be safely monitored on these drugs.
Dr. Coleman found many areas in England don't have the specialist NHS services that can prescribe Wegovy.
Less than half the country had access to specialist weight management services.
It's a similar picture in Wales, while Northern Ireland doesn't have any services. And many of the areas that do have services have long waiting lists.
A third of the country is living with obesity, which is a major issue. And so people need to be able to access effective treatments to help support them towards a healthier weight. If people don't have access to a specialist weight management service in their area, then they're not going to be able to access Wegovy.
And the situation could get worse. In 2022, the government cut £100 million from weight management services funding that it had announced just a year earlier, meaning some clinics may have to close and making access to weight loss drugs such as Wegovy even harder. Just how big a problem is this, Professor Tan?
The estimated number of people who potentially going to be eligible for these weight loss treatments in the next few years is been estimated to be about 4.2 million. But in reality, we are probably only going to be able to treat around 50,000 of these patients. So it's a big problem in terms of how we can actually address obesity.
The Department of Health and Social Care told Panorama the latest obesity medicines have the potential to be game-changing. The government is leading the way to increase accessibility to these drugs safely for those who are eligible through a £40 million pilot scheme to explore how these new obesity medications can be made available to more people through non-hospital settings. With limited NHS provision, the only way many people can access Wegovy is to pay for it privately. Dr. Sue Keneally believes that will widen health inequality.
Wegovy is available privately, but it is really quite expensive. It's around £250 to £300 a month, and that is financially out of reach for a lot of people. We know that obesity tends to affect more people in more deprived areas, so they are the people who are likely to need it most, and they're equally likely to be the people who are least likely to be able to afford it. This is yet another example where deprivation means you're at yet another disadvantage in terms of being able to access effective treatment for your health problems.
And Dr. Amati also wants to know if private online providers such as Kelly's are giving adequate advice and support to ensure Wegovy is used safely.
My prescriber, they do send out regular emails about nutritional support, how important exercise is, but it is on the user. It is up to them to actually make the effort and read those emails.
And is there any attempt by your prescriber to actually personalise that information to you, to tailor it to your needs?
No, it's very generic.
And to be able to maintain a healthy weight and actually drive that weight loss into better health outcomes, it's really important that we have personalised nutrition advice that suits you.
The makers of Wegovy, Novo Nordisk, told Panorama it does not condone misuse of any of its medicines outside of their approved use. Wegovy is a prescription-only medicine and requires a healthcare professional to prescribe under strict supervision, and that it takes its responsibility as a manufacturer very seriously and offers clinical training to any healthcare professional who utilises its weight loss medications as part of their clinical practice.
Almost all the experts I've spoken to agree that the new generation of weight loss drugs like Wegovy can potentially help Britain tackle the obesity crisis. But they're not going to solve it on their own. Instead, they're a tool that can help as part of a much bigger shift in our lifestyle and our diet.
At this Devon GP practice, Dr. Ruth Tapsell is tackling obesity by encouraging that shift, trying to reduce patients' reliance on medication. Instead, she's working with patients to change their diet with striking results.
We're on our way to see Richard, who's a patient of mine in his 50s who was diagnosed 2 years ago with type 2 diabetes. Richard had a really high blood sugar, but was very keen to address it with lifestyle changes.
So back in October 2021, my levels were up at 93, which is, as I understand it, more than double the level that qualifies me as being diabetic, which was a bit of a shock. Then I went back into the surgery and had your advice on how to reduce my weight.
Part of that advice was to radically change his diet.
We encourage patients to cut out sugar, ultra-processed foods, but in addition to that, we ask them to cut right back on their starchy carbohydrates as well, and that's been phenomenally effective.
The diet had really had a massive impact and had put the diabetes into remission.
Yeah, amazing. So it's definitely possible, isn't it? You've demonstrated that so clearly.
And losing the weight has had other benefits.
So how are you feeling?
I've got much more energy. I'm enjoying going out and doing exercise, and I'm able to cope with that easily now, whereas before I'd be out of breath.
More than 40% of Dr. Tapsell's type 2 diabetes patients have lost weight through dietary change and put the disease into remission. So should government be pushing diet and lifestyle changes harder, alongside the introduction of weight loss drugs? In 2019, Henry Dimbleby was asked by the government to come up with a national food strategy to help tackle the obesity crisis and lessen the environmental impact of food production.
The government has a big problem, and the big problem here was the fact that our food system was making us sick. There was a study that came out at the end of last year that estimated that the damage being caused cost the UK £98 billion a year. That is almost as much as we spend on all the food we buy. So we recommended that the government, to break that junk food cycle, the government needed to regulate to make it commercially less attractive to market and develop products that would make us sick.
The government hasn't implemented many of these recommendations. And in June last year, Rishi Sunak delayed a proposed ban on buy one, get one free deals on unhealthy foods until autumn 2025.
On the health side, they've gone backwards. I'd actually say they're doing less on health than they were before they commissioned me to do this report. Basically, we have a situation where the food we eat is killing us. Government isn't doing anything about that. And because government is inactive, the drug companies are moving in.
We've rejected a national food strategy that actually looked to address all of the factors that are contributing to the rise in obesity. We've also given the go-ahead to these drugs, which, yes, have a place in medical practice, but we haven't given the right support network to make sure they're prescribed responsibly and with long-term health in mind.
The Department for Health and Social Care told Panorama that it's taking strong action to encourage healthier food choices and to tackle obesity. The introduction of calorie labelling is empowering people to make informed choices, and it has introduced legislation to restrict the placement of foods high in fat, sugar or salt in supermarkets. In addition, it is helping children and young people have an active start to life with over £600 million funding for the PE and sport premium. Kelly has now been on Wegovy for 12 weeks.
I'm currently not suffering from any side effects. It's working really well to satiate my appetite. Over the festive season, I did put on £2, but overall, since starting Wegovy, I have lost nearly a stone. Going forwards for this year, my main focus is to concentrate on my diet and the nutrition. I'm going to be doing not only what's best for my body and my weight loss, but what's also best for my health.
This will be the year the first NHS patients discover if Wegovy will work for them. However, for millions of others, safe access to drugs like Wegovy on the NHS looks to be a long way off.
Well, I think the government needs to actually invest more into treatment of obesity. These drugs are available, but we are not able to use it in the NHS effectively. So it's a real problem.
I do feel that this tidal wave of ill health that's coming towards us, we're only in the foothills of it, and people just don't realise it. I hope that we won't have to wait for it to completely destroy the NHS, destroy more lives before we take action.
The new generation of weight loss drugs seems like a big step forward in the battle against obesity, but it's very early days. And the scale of the crisis means it'll take a lot more than new drugs to solve it.